Hello and welcome to Headline News in Neuroendocrine Tumors, or ENETS. I'm Steve Highsmith. This series of videos will focus on several important abstracts presented at the 8th Annual European Neuroendocrine Society meeting held March 9th to 11th in Lisbon, Portugal. Throughout 2011, Oncology.TV will bring you in-depth coverage of the latest data and abstracts presented at major Neuroendocrine Tumor Society meetings. In this segment, we'll be hearing from Drs. Philippe Ruszniewski and Juan Valle about their poster presented at ENETS titled Overall Survival Analysis of Sunitnib After Adjustment for Crossover in Patients with Pancreatic NET. Doctor, describe the rationale for conducting this trial.
Well, as you know, the result of this trial showed not only a significant difference between sunitinib and placebo as far as progression-free survival is concerned, but also in overall survival. However, we were concerned by the fact that crossover, which was allowed and even permitted by this study, would affect the true difference of survival between patients receiving placebo and those receiving sunitinib.
And what is the main objective for the trial?
Well, first of all, the global trial was to look at a difference in progression-free survival between sunitinib and placebo in patients having malignant pancreatic endocrine tumors. The secondary endpoint of this trial was overall survival, and this parameter can be affected by the crossover design of the study.
Can you describe the concept of crossover? What does it mean and how does it impact a clinical study?
Crossover is the fact that in a clinical trial which compares an experimental drug to a placebo, those patients who receive the placebo could receive the experimental drug after progression. So by definition, I would say that this kind of possibility would not affect progression-free survival. But if the patients receive the active drug, and of course, if the active drug is really active, providing a survival advantage, this difference will be decreased by the fact that the patient received not only the placebo, but also the active drug at the crossover.
Dr. Valle, can you describe the trial design?
So the original study was a prospective phase 3 randomized controlled study where patients with progressive pancreatic neuroendocrine tumors were randomized to receive either sunitinib or placebo in a double-blind manner. Treatment continued until disease progression, and on progression, patients then had the possibility of going into a follow-on study where they received active agents.
Dr. Valle, please tell us about the methodology and how you accounted for bias, which endpoints were affected by crossover.
Okay, so the primary endpoint of the study was progression-free survival. That remains unchanged as a result of this additional analysis. The original analysis also looked at overall survival and showed a 60% reduction in risk of death. What this further analysis has done is been able to establish that the overall survival advantage may be greater than that once crossover has been taken into account. That hazard ratio reduces right down to 0.14, which is probably at the upper limit of the survival advantage, compared to the one reported in the original trial, which was 0.41.
So, Dr. Valle, what does this mean to you as a practicing physician?
As a practicing physician, it's an exciting time for us with new treatment options available for patients with pancreatic neuroendocrine tumors. I think initially what we need to do is to make sure that patients who need this treatment do get access to it. And I think moving forward, we need to be involved in future clinical trials, both clinicians and patients participating, to look maybe at combination studies, sequencing studies over the next few years.
Based on the results of this study, where do we go from here?
I think the results of this further analysis really confirm the strength of the evidence of sunitinib in advanced pancreatic neuroendocrine tumors. So I think that allows us to make sure that we are prescribing treatment based on good, sound, well-designed clinical trial.
Gentlemen, thank you for your time. That's Dr. Philippe Ruszniewski and Dr. Juan Valle talking about the impact of crossover on clinical trials. And the poster presented at ENETS titled Overall Survival Analysis of Sunitnib After Adjustment for Crossover in Patients with Pancreatic NET. We thank all of the experts who participated in this edition of Headline News in NETS. I'm Steve Highsmith. Be sure to watch coverage on the latest news in NETS right here on Oncology.TV.